Assalamu alaikum, ladies and gentlemen. I'm very happy to be here today along with my team of officers. First of all, I would like to thank the organizers, especially Dr. Tariq Khan and his team, for inviting me and the officers of the senior management course to be a part of this landmark initiative. It is quite significant that the policy proposals for neurotrauma care in developing countries are taking shape in Pakistan, and that too in Peshawar. The Sustainable Development Goal 3, Target 3.6, has brought much needed focus on development of robust national plans for surgical care, and it is heartening to know that a lot of progress has been made in 4 years since 2015 in enhancing the care for head and spine injury and LMICs. The road safety situation in Pakistan is indeed alarming, and according to the World Health Organization 2018 report, every year around 27,582 people die on the roads in Pakistan due to traffic accidents. Around 50,000 people become victims of disability due to road crashes. Persons with disabilities are the most abandoned, marginalized, and unrepresentative group in Pakistan, who are facing a multitude of social, economic, physical, and political barriers which profoundly hinder their mainstreaming in society. With this background, the Peshawar recommendations are indeed a landmark achievement for improving neurotrauma care in Pakistan. But this is just the first step in the right direction. The even bigger challenge now is to integrate these policy recommendations into national policies and plans. The 6 components recommended by the Lancet Commission for the National Surgical, Obstetric, and Anesthesia Plans provide an excellent framework for adoption in national and provincial health policies. These 6 components, which are infrastructure, workforce, service delivery, financing, information management, and governance. The developed policy matrix recommends overlaying these 6 components with the 5 stages of head and spine injury care identified by the American College of Surgeons, that is surveillance, prevention, pre-hospital care, surgical system, and rehabilitation. It is heartening to know that these policy recommendations have the ownership and backing of the Provincial Health Department of Khyber Pakhtunkhwa. The real challenge now lies in the implementation of these policy recommendations. Unfortunately, in the past, many good policy initiatives in the country have faltered at the implementation stage. It is therefore absolutely imperative that the components of these policy proposals are fully integrated across various sectors in the provincial health and road safety systems. This can only happen through robust public health education and effective training plans for the concerned professionals. Successful implementation of these policy recommendations in Khyber Pakhtunkhwa will surely help in their diffusion across the country. We at the National Institute of Management Peshawar will try and play our part in this capacity building effort, and that is precisely why our officers are here today. They are senior level civil servants and are soon going to occupy important positions in different sectors. So we hope that they will play an important role in integration of these policy recommendations in the relevant government policies and plans. And wishing this conference all the best. Thank you very much.
Thank you very much, Farah Hamid. May I request Corrado Iaccarino from Italy to say a few words just regarding these recommendations?
Once again, thank you. Thank you for your hospitality and thank you to be part of this important event. And the comment that I can do is that, especially for young neurosurgeons, that you should take in consideration that before that you are a neurosurgeon, you are a human being, you are a citizen of your city and of your world. And when I say world, it's world because with Twitter, with Facebook, with the socials, we are more you than me that I'm geriatric neurosurgeon. citizens of the world. So think about the pillar of TBI that is prevention. Think about if you conduct a campaign through the social system, Twitter and social, to communicate by a neurosurgeons how the TBI is not a disease, but is something that is avoidable. So you can understand how recommendation is a state of mind. Recommendation means to organize our works in a way that you can find your works in all around the world. As Gail said yesterday, I want to travel and I want to go in a country where I well know that if I have a TBI, I can meet the same care, the same quality of care, or at least I can meet a surgeon with the same quality of thinking about our works. So this now with the so rapid spreading of the communication, the recommendation is a little bit different with our young generation. Now, when we start to make a recommendation, we need to organize meetings. We need to move surgeons to put in the same place to talk about recommendation. Now, this need is not so essential, and we can spread the recommendation in many, many ways. So thank you.
Thank you very much, Corrado. I will request our chief guest, Dr. Sania Nishtar, to give her comments, and after that, we'll open the house for discussion. Please. Thank
you. Conference Chair, Professor Tariq Khan, our senior colleagues in neurosurgery, visiting friends from abroad, delegates, officers of the government of Pakistan, a very good afternoon and assalamu alaikum. Let me at the outset congratulate the conference organizers. I just got to know that it's a conference with representation from 27 countries. There are 71 foreign dignitaries present here. There's representation, heavy representation from the government. This is not a mean feat. A conference of this scale is very difficult to pull together, especially when there are threats of dharnas looming. So I congratulate you, Professor Tariq, and I must accord my appreciation for the work you do. We not only are you a clinician of excellence, as are many others present here, but I also see that you've played a very proactive role in developing the private sector, taking it to scale, and focusing on public health issues in a very meaningful manner, helping to bridge the evidence policy disconnect, bringing together international players to frame recommendations, and then making sure that the government leaders of tomorrow are at the table to actually cascade them into implementation. So my congratulations to you and your group for a very, very meaningful role in this space. Our government believes that development, people's welfare, the social sectors are not the business of the government alone. Our government is strongly of the view that it is through the role of the private sector, through the input of professional associations, through the contributions of the civil society, and of course with the government playing a shepherding role, a strategic catalytic role, a policy, a normative role, a regulatory role, and with integrity that we can bring meaningful change within the society. And it is on this premise that I really welcome the invitation to be with you today. So a couple of reflections with my global health hat on, because we fundamentally believe that with regard to universal health coverage, which is the central pillar of the Sustainable Development Goals, we cannot just speak of universal health coverage for communicable diseases, for maternal and child health, that non-communicable diseases are a very central part of that. And when you talk about non-communicable diseases, it is not just medical end of the spectrum, but also the surgical end of the spectrum that we have to focus on. And I recall it at last year's UNGA, which was the UNGA themed on non-communicable diseases. I spoke about it on so many sessions that people actually started thinking that I'm working with the surgical group. So I'm very much part of your community. And in my capacity as chair of the NCD's Commission, wholeheartedly support the inclusion of surgery in the package of measures around NCDs, which now need to be mainstreamed into NCDs. Putting on my government hat as a cabinet minister, I assure you of our fullest cooperation. As I said, our government squarely believes that development, as I said earlier, is not the business of the government alone. So I just want to reflect a little bit on this new program that the government has, which I have the responsibility of shepherding, called ESAS. ESAS is the Urdu word meaning empathy. And as part of ESAS, the government at the federal level is rolling out a very ambitious agenda of 134 policies and programs, a multi-sectoral and an intersectoral agenda, embedding welfare and development and human capital development into the program of work of various ministries. And one of my earlier meetings this morning was with the government of KP to see how we could cascade a similar program within the workings of the government of Khyber Pakhtunkhwa. So I can commit to three things right away to you. Number one, there is a huge information dissemination agenda embedded in the recommendations you gave today. Because I was looking at your recommendations, there are systems-wide recommendations. You talk about workforce, about information systems, about service delivery, about governance, about the financing of neurosurgery. And then you weird it to neurosurgical care. And I think Professor Athar very nicely subdivided into various categories. So the information piece is a very important part of that. And we can find ways of working with your association to embed it into the ESAS agenda. Every morning when I go to work, I'm on the road for about 20 minutes. And one of the things that really strikes me is the number of people who are exposed to neurosurgical, to trauma risk. So these are not just people driving the motorbikes. These are actually the 2 to 3 people sitting behind them, women and children. So at an average, there are about 3 people on a motorbike. Our law stipulates that the person driving the motorcycle has to wear a helmet. But what about those at the back? It's a simple measure that the government can take to expand the base of the legislation. Just the other day, I saw a terrible accident. There was a young man right ahead of my car who crashed against something. I can't remember what it was. He fell on the road. He was wearing a helmet. And with my own eyes, I saw his helmet toss off to one side and his head banging against the road. And he could not make it to Professor Khaliq's. He died instantly. The point I'm trying to make is that information is so critical. It's not just the wearing of the helmet, but also tying the band around. It's a very simple thing. And since that day, I have consistently observed on the road the number of individuals who are wearing helmets, but very few of them are actually tying whatever you call around their chin. Effectively, though, even those who are wearing helmets are not wearing helmets because of what I witnessed. And I think this is a long-winded way of saying that there is huge potential to embed information, common sense information, pedestrian information of this kind into the agenda of information campaigns that the government hopes to put money behind. That's number one. And I can commit to you that we can talk about similar measures very seriously and also more holistically at a global, in the realm of global surgery, because I know that Keepak and hopefully John Mera are also listening in to in this conversation. Secondly, as part of the ESAS framework and to signal our seriousness to engage the private sector, we have opened a portal called Pledge to ESAS, where the private sector can make meaningful and concrete commitments in support of the government agenda. and seek support in a strategic manner. The portal has currently had its beta release. We are concretizing that, and I'm very happy to share the link to that portal with you and engage around how to make specific commitments. And thirdly, as you know, earlier this year, when we outlined the menu of programs that are being rolled incrementally every month around SARS, one of the programs that will be released early next year is called the HAFOS, which means protection, and it is basically protection against catastrophic expenditures. And when that portal of the government opens, I can promise you that financial access for neurosurgery will be made part of that, and surgery more broadly. So I want to thank you once again for the honor of having me here. I want to congratulate you once again. And I also want to congratulate and want to thank John Mira's group for the very meaningful engagement that they've had in the development of the neurosurgical sector, not just the neurosurgical sector, but the surgical sector in general in Pakistan. I think they have a very huge contribution in bringing to light the salience of surgeries, especially after the work that they did with the Lancet series and the couple of big metrics that they put out there for advocacy. So congratulations once again. I look forward to continuing to engage with you, and hopefully we'll have a meaningful collaboration for the way forward. Thank you very much.
Thank you very much, Dr. Sania. Dr. Sania has a very, very busy schedule, but still we are very grateful that she could make it here to talk to us. So if any comments, questions, Key, are you there?
Yeah, I'm here. Hi.
Okay. Yes. So we are very grateful to Dr. Sania about what she has promised. And if there are any questions, comments from anybody, please, you can join in now. Athar? Yeah. Yes.
I was just wondering, can they go through the process that Pakistan is evolving now for the NSOAP and the surgical vision, step by step and what the milestones are? Years be very informative, I think.
Oh, we're just going to give a shield to Dr. Sania and thank her because she has to leave now back for Islamabad. So. Please. Yeah.
Andrew, you want to repeat the question again? So, or you want to wait for a couple of minutes?
Yeah. Well, I was just wondering if any one of you would be in a position to give sort of the timeline for achieving the goals for 2025 for surgery in Pakistan and the NSOAP implementation. What are the milestones and et cetera?
Dr. Lubna Samad was supposed to come in and give a talk on that, but unfortunately she's not here. But we know this much, that all the discussions have been completed on both the national plan and the provincial plan. And it is now with the federal government. And we hope that in the next few months, they would give us a timeline. There's no timeline yet, but they give us a timeline very soon into that. Professor Lane, would you like to say a few words on on at least the global surgery aspect, because I know you have been very much involved in all this for a long time.
Thank you very much indeed, Derek. First of all, thank you for inviting me here amongst the honorable neurosurgeons. I've had a very informative 2 or 3 days. As far as global surgery is concerned, things are moving, not as fast as we would like, but they are moving because these changes take time. And the important thing, and I was just listening to the previous speakers here, really is to think about prioritization. You have all these lovely things to do. What are you going to do first? And what follows first comes second and third. But I've read through the recommendations very carefully, and I think that certainly you're way on the right lines. And I've been most impressed by what I've seen here in Peshawar, and I have no hesitation in saying that I think that this is going to be a successful event, not just for Peshawar, but of course for Pakistan too. Thank you very much.
So just a comment on that one, Professor. Yes, I think we have to look at it at different levels, at the level of an individual, at the level of an organization, and at the level, at the higher level, highest level, the government level. And I think it needs to start with thinking that there's a big problem in front of you. What are the things that you can do in the next 2 years, in the next 5 years, in the next 10 years? So just resonating what you are saying is the Center for Global Surgical Care that we have started. So our plan is in that way, that in the next 2 years, we want to initiate these couple of things, get some research funding, start some incorporated into residency training, and initiates any kind of a public health work under the auspices of their center. So a little success over there is gonna give us encouragement. We will move on. And in the meantime, the other things of trying to interconnect with the agencies and other organizations in the government is going to go on. And eventually we plan to join hands with all the global health aspects in people in this country to do something and then beyond. So thank you.
Thank you very much. Any delegates from the developed countries, maybe they want to put some input into this and see how they can help the lower and middle income countries develop these recommendations, put them actually into place. So from anyone, Randy?
Well, sorry? Yeah. Well, I can just reflect on what we've done in Latin America. And that's mostly data driven. I think what we've done is allowed the people in the various research centers access to their own data, and we've helped them with the analysis of those. Because I think that the solutions that have been come up with have been unique. And the reason I think that's important is, as I said today, one country, the transport to hospital was influenced by private clinics wanting insurance. That solution to that problem made a big difference. We saw it in our research data just by making that public, and it sort of stopped happening. That solution wouldn't have worked in another. Training taxi drivers in basic life support in transport and then having them call in to the hospital in which they're bringing the patient is an ersatz transportation system that I don't have to use in Seattle because I've got helicopters, but it certainly seems to have worked in that when it's been started in a couple countries in Latin America, a couple cities in Latin America, and in Charlie Mock's study in Ghana. So I think the idea is this is a global perspective on what needs to happen, but I doubt any solution, any regional solutions will translate easier to other regions. So I just think local solutions and the collection of local data, the application of potential solutions, and then feeding that, closing that loop to see if it's actually working will allow you to reach these goals. You know, these are the end goals, but the mechanisms have to be unique.
That's why we have the word local instead of global, right? Yeah.
So, yes, please. Alistair, thank you.
One of my patients told me a very sad story. He'd had his driving removed because he'd had a couple of drinks, had an argument with his wife, and she'd thrown him out. So he went out to the car and he sat in the car. Then it got a bit cold, so he turned on the engine. And the second he turned on the engine, the police pounced because he was driving in charge of a car. Now, that's so many worlds away from the policemen who are waving past, that I saw, waving past rows of motor scooters here with people with no helmets on. So given that that is one of the biggest sources of head injuries here, surely to goodness, you have to enlist the help of the police in actually enforcing their own laws. And how do you go about that, Tariq?
I wonder if Peter Hutchinson is online here, or Anders Rubiano. No. Okay, Key, can you tell us? You have, I think, if I remember correctly, you had given a timeline regarding the recommendation, how to go about them. Can you elaborate on that a bit again?
What do you mean by timeline, Tariq?
Timeline to implement these recommendations. How are we going to go about that?
Right. No, that's a great question. So if you look at the Sustainable Development Goals, those are supposed to be achieved by year 2030. We're at just the doorsteps to 2020. We have 10 years left. Right. So if you look at the overall surgical global surgery movement's target is 80% of the population within 2 hours of a surgical facility. No, our targets are somewhat similar to that because we don't want to create a sort of a conflicting objectives. But we only have 10 years. So if countries are still developing policy and strategic plans, they're going to have to hurry up, right? I think what it means is really we need to start training now. We need to start engaging civil society now. We need to start talking to funders, not just government funders, but major charities, major philanthropic organizations like Gates Foundation. Yeah, we just have to start, not wait, but start working in all different ways. But yeah, we should all at least try to achieve it by 2030.
Yes, thank you very much. I think I think Peter Hutchinson is watching us, but I think he can't get in connected, and maybe the same with Anders Rubiano, because we changed the Zoom link, and unfortunately I forgot to tell them yesterday. My fault. Too many things on my mind. But they are at least Hutch is online and watching us on Neurosurgery TV. I think it would be a good idea that if we all when we are in Bogota for the 2021 WFNS meeting, I think this part should be discussed in detail again, and we can ask Anders Rubiano to arrange a special session, and so that we can discuss on where we have gone and what have we achieved in any of the countries who are going to be part of this recommendations. What do you say?
I think so. Bogota, the WFNS Congress will be just 2 years from now, which will be total 5 years since the Bogota Declaration. I think it's a great place to sort of take stock. I will tell you this: neurosurgeons are so far ahead right now in the global within the global surgery movement as a specialty. I can tell you the ENT groups are just starting to collect workforce data. The plastic surgery groups looking at us and saying, how did you get all this information? So we're sort of leading the way, we're for the other subspecialties in surgery. And then with this new global neurosurgery coordination mechanism for global action plan, I think this will really channel our efforts and get there faster and with greater impact.
Thank you. Yes, we launched the global surgery chapter committee this morning, and so it was well received by everybody. And I think that would be a very good forum now to continue all these recommendations and everything and discuss them with everybody. So if there's nothing else, I think we are going to take a break now. And we will start with the sessions after tea, the next sessions after tea. So we finished early. Thank you very much. Thank you all. Thank you, Key, and thank you, John, for all the help.
Yeah.
Take care. Bye-bye.